The above elbow posterior splint is used to immobilize the elbow and forearm while allowing swelling to subside. In this presentation, the application of the above elbow posterior splint will be demonstrated. The objective of the exercise is to understand the correct application of the above elbow posterior splint. The above elbow posterior splint is indicated for fractures of the forearm as a temporary splint which will allow swelling to subside before definitive treatment, and for fractures and soft tissue injuries around the elbow. A circular cast is never used for fractures and injuries around the elbow because of the danger of swelling and the development of compartment syndrome. This is the hand of a patient with a Folksman contracture after a compartment syndrome. Because of fibrosis of the flexor compartment muscles, the patient has a flexion contracture of the wrist and finger. To apply the above elbow posterior splint, the following materials are needed: a stockinette or tubular gauze bandage. Cotton wool will be used as undercast padding. Scissors. Plaster slabs, generally 5 layers thick and available in differing widths. Crepe bandages to secure the plaster slabs. And water, or another wetting agent. The water should be tepid or lukewarm with an ideal temperature of between 22 and 25 degrees Celsius. It should be noted that colder water or a bandage that is wetter will allow for an increased working time, while warmer water or a bandage that is drier reduces the working time. The patient should lie on his or her back with the arm raised and the elbow flexed to 90 degrees. Consequently, an assistant is needed to support the arm in the desired position. The patient would normally be anesthetized. Care should be taken to avoid spilling plaster into the patient's eyes. The distal border of the above elbow posterior splint is the distal palmar crease. An easy landmark for the proximal border is the deltoid insertion. Overflexion may result in constriction of the brachial artery, while extension of the elbow may lead to loss of reduction. The assistant supports the fingers while the stockinette is applied. Here the stockinette has been pre-cut to the appropriate length. The cotton wool is used for undercast padding. A slit is cut in the cotton wool for the first web space. It is gently wound once around the wrist, then towards the elbow with an overlap of 50%, which creates a double layer of padding. To avoid constriction, the edge of the cotton wool should not lie within the crease of the elbow. Rather, it should be wrapped around the elbow, as demonstrated here. The cotton wool extends slightly beyond the planned edge of the slab to provide a soft edge. 2 strips of cotton wool are placed to pad the bony prominences of the olecranon and the condyles of the humerus to prevent pressure points which could create pressure sores. Three slabs will be used. The first slab is wetted by dipping it in water. The excess water is removed by squeezing it. The slab is applied, beginning proximally, and passes over the elbow. Any material that extends beyond the distal end is folded over for increased strength. The second slab is wettened and applied distally, beginning on the radial side and passing around the elbow to the ulnar side. The third slab has been cut into 2 parts, each with the desired length, and applied as shown here. The resulting overlap provides extra strength. Beginning proximally, the slabs are secured in place with a crepe bandage. However, the slabs are still too soft to mold. Once the plaster has begun to set, the slabs may be molded with gentle pressure to the radial and ulnar sides of the forearm, the wrist, and the palm of the hand, in order to obtain a better fitting splint. Both hands are wrapped around the patient's wrist, with the thumbs applying pressure to the palm of the hand until the slab begins to set. In the case of an active child or disoriented adult, an extra crepe bandage may be applied around the elbow with several figures of 8 to provide additional stability. To create a smooth edge, the ends of the stockinette are folded over. The application of the above elbow posterior splint is now complete. The reduction may be verified with an X-ray.